Hello and welcome to another episode of the TheSynapse e-learning series. With us today we have Dr. Eileen Clark, Consultant Dermatologist, who will be speaking to us about skin tattoos and their related complications. Dr. Clark, thank you for being with us here today. On to my first question. Here in Malta, do you think that the incidence of skin tattoos has changed over the past decade?
So we don't actually have data about the incidence of tattoos in Malta, but it is the general perception that tattoos are increasing, and people from all walks of life these days get tattooed. In fact, if you open the yellow pages, you'll find around 60 adverts for tattoo artists and tattoo parlors, and there are even international conventions organized in Malta, bringing together local and foreign tattoo artists.
And I understand that in the past, preference was mostly given to tattoos which were based on metal salts. But nowadays, at least internationally, there has been a change to plastic-based pigments. Is it the same here in Malta?
We don't actually have data about this, but traditionally, tattoo pigments were made of particulate matter suspended in diluents. And this particulate matter depended on the color of the tattoo. So, for example, black tattoos contained carbon and iron oxide, iron salts. Color tattoos had different metals usually. For example, chrome for green tattoos, cobalt for blue tattoos, manganese for purple tattoos, and importantly, mercury for red tattoos. These days, there are newer dyes being produced and used. These are organic substances containing azo and polycyclic dyes. These are soluble compounds, and they have the advantages of avoiding the use of metals, and especially heavy metals, and they also produce more vibrant colors. There are also other dyes produced from extracts from plants and vegetables. Now, there is no actual law regulating tattoo pigments. There are laws regulating tattoo artists and parlors, but not the tattoo pigments, neither in Europe nor in America. So the actual composition of a tattoo pigment would be unknown. Tattoo artists keep their ingredients secret. It's a secret recipe. So most probably, most tattoo pigments are a mixture of traditional pigments and newer dyes.
And what are the short-term complications which may occur after a tattoo is performed?
These can be divided basically into inflammatory and infectious complications. So if we go to inflammatory reactions, the acute reaction is basically a normal reaction to a tattoo. It results from injury to the basement membrane, to the epidermal basement membrane, and it results from needling or irritation from alcohol used to cleanse the skin, and it results in necrosis of epidermal and dermal cells. And the reactions would usually consist of erythema or perhaps swelling, which should, however, subside within 2 or 3 weeks. Then other acute complications are acute infections, which are probably quite common. They occur because of disruption of the epidermal barrier. The causative agents would probably be normal skin flora, and they can result in impetigo, cellulitis, erysipelas, or even abscesses.
We've spoken about complications in the short term, so in the first few weeks, but in the long term, over months and years, do you encounter any other complications?
Yes, you can. Again, they can be divided into allergic reactions, inflammatory reactions, and also infectious reactions. So if you go to inflammatory reactions, you can get eczematous, allergic reactions. You get an eczematous eruption with erythema and scaling and perhaps even exfoliation. Another reaction is a phototoxic reaction, which occurs due to cadmium in yellow pigment usually, or cadmium added to red pigment to make the red more bright. And so a person with a tattoo might get an inflammation of the tattoo when it is exposed to sunlight. Then there are the delayed hypersensitivity reactions. These would include acute contact dermatitis and also more chronic reactions resulting in lichenification and erythema. Then there are quite a number of other hypersensitivity delayed reactions for which we don't know the actual mechanism, and they are described histologically basically and named histologically. So, for example, you can get a lichenoid reaction, and this can take the form of lichen planus-like reaction, or an actual lichen planus developing in the tattoo and then becoming more generalized all over the body. You can get what we call pseudolymphomatous reactions, which need to be distinguished from actual lymphomatous infiltration of the skin. Lupus erythematosus-like reactions, necrobiotic reactions, including granuloma annulare-like reactions, and another type of reaction called the pseudoepitheliomatous reaction, which has to be distinguished sometimes from actual squamous cell carcinoma because it can look very, very similar.
And in fact, I wanted to ask you about malignancy. There's a misconception that tattoos may predispose to malignancy. How do you comment?
Tattoos don't really predispose to malignancy. There is one lesion that may occur within tattoos, which has a very, very, very slight potential of becoming malignant, and that is the keratoacanthoma. Keratoacanthoma normally occurs on sun-exposed areas, but there have been recorded cases of keratoacanthomas growing on tattoos. But apart from this very negligible risk, tattoos don't actually predispose to malignancy. However, the tattoo might mask a growing lesion that is malignant. For example, an evus which is tattooed might not be easily recognized when it's changing to becoming malignant. So in this case, actually professional tattoos try to avoid tattooing the actual nevi. They go around them or include them in their pattern, but avoid putting pigment in them.
So I understand that they may mask the malignancy because they confound the diagnosis, so clinically you can't actually examine the blemish, so to speak, and also histologically, does it affect the sampling when there's a tattoo mixed with the...
Yes. Histologically, until markers are used, it might be a bit difficult to distinguish the pigment, whether it belongs to the nevus or belongs to the tattoo.
Exactly. We've mentioned a number of complications, both in the short term and in the long term. A tattoo performed on a patient who suffers from a chronic skin condition, does he have added risks when applying to have this tattoo?
There are perhaps few conditions that one may consider. For example, if you suffer from psoriasis, you might get what we call the Kebner phenomenon. So psoriasis will develop on the traumatized skin. The same with lichen planus. You can get lichen planus developing as a Kebner phenomenon on the tattoo. Also, perhaps people who have a tendency to keloid scars, perhaps they might want to avoid having tattoos in the upper parts of their body to prevent getting keloids.
And here in Malta, especially since we're speaking on a local level, are non-sterile tattooing techniques still a health risk?
Non-sterile tattooing techniques are always a health risk, whether in Malta or abroad.
But are they still prevalent?
I don't have actual data on this, but one has to be extremely careful. Abroad, there have been cases of, for example, atypical mycobacterial infections, abscesses, developing from contaminated water used to dilute certain inks. In fact, they would then result in abscesses on the grey areas of the tattoo because they used contaminated water to dilute the black ink. There have also been cases of MRSA abscesses causing quite difficulty in treatment and resulting in a lot of scarring. Then there's also the risk of viral infections, hepatitis B, C, and even HIV. They have been recorded. I have no knowledge of their occurrence locally, but they do occur abroad, but virtually never in licensed parlors.
Very good.
There are also other viral infections that can occur. HPV, you can get warts on tattoos, and molluscum contagiosum as well, resulting from contamination either of the ink or of the apparatus used.
From your point of view as a dermatologist, any final comments or advice to the general practitioner who meets a patient with a tattoo and is at odds whether there's a complication or whether to refer for specialist care?
Yes. So a patient who presents with a reaction on a tattoo might need biopsy of the lesion. For example, we might need to have an accurate diagnosis of the type of reaction so that we can treat appropriately. Also, for example, there's another complication. You can get sarcoidal infiltration in a tattoo, and if this is diagnosed, then the patient needs further investigation to exclude systemic sarcoidosis. Also, some lesions developing on a tattoo may need to be biopsied to differentiate between a normal, not normal, a side effect or a complication of the tattoo or an actual malignancy. The other point is that some people might want to remove tattoos for various reasons, and tattoos can be removed using Q-switch laser, and even this can have its own risks. It can have risks of scarring and hypopigmentation. Sometimes a tattoo may actually darken after treatment with laser because ferric oxide salts change into ferrous oxide salts, which are insoluble and very dark. And sometimes, as the laser breaks down the pigments of the tattoo, which are then drained lymphatically, as the pigment spreads away from the tattoo site, there might be a reaction to the pigment which is more generalized than the local tattoo area.
Thank you, Dr. Clark, for your very informative input on tattoos and their complications. We hope that to our audience this interview has been very fruitful, and we invite you all to join the TheSynapse Facebook page and subscribe to our YouTube channel to follow us for further episodes. Thank you.